Welcome. Let me just introduce myself. My name is Shawn Burger. I am a private practice owner in Northern California, dealing in outpatient orthopedics. Our point of kind of discussion this afternoon is just to talk about a few things as it relates to pain management. We don't always consider, although we see it every day, is that effectively 100% of our patient population comes to us with some sort of pain. It's their number one complaint. Pain in my shoulder, pain in my knee, pain in my back. When patients don't have pain in their perception, they literally aren't coming to us. And you can judge that yourself when you just watch people at Disneyland or walking up down the street. Many people have postural dysfunction, many people have mechanical dysfunction, and they're not into our offices. When they come to us because they are in pain. So, as physical therapists, what do we do to mitigate that pain? We focus on corrective exercises, mechanical adjustments. Is the body, the posture in alignment? Can we educate them in those areas? Can we teach them exercises to improve strength or slow down the progressiveness of weakness and things of that nature? But what are we doing for pain? Well, the simple answer is for a lot of us, we either aren't addressing it in the clinic right away, or we are looking at in-clinic pain modalities. In-clinic heating pads, in-clinic ultrasound, in-clinic mechanical stim, okay? So if I can introduce a couple different concepts or different ideas to how we might address pain and look at pain, it may just change our perception just a little bit. One of the products that has been around for many, many years and people have heard about and we don't always consider is the product of Biofreeze. How many of you have heard of Biofreeze? Okay? Essentially all of us. Let me ask you this, and I know the students, you guys are getting out in the field, so you're gonna run into it into the clinic. We've all heard of it. How many of us use Biofreeze? And this is my experience as well. Maybe 25 to 40% of people that actually use it. I simply ask the question, why not? And I get a variety of answers. Maybe it's, well, I just have never tried it, or I'm not sure how topicals work, or things of that nature. I'd like to make sure that before you guys leave today, come up and grab a sample, okay? But the key thing that we want to address in Biofreeze is that I want you guys to take home from the message is that the critical ingredient of it from a topical standpoint is menthol, okay? When that menthol hits the skin, there are literally over 200 studies that indicate and show us that it has a pain-reducing quality. Now, we can get into discussion about those studies. Is it a reaction to a specific receptor, or is it an afferent stimulus? But the bottom line is it does reduce pain. Why is that important? Because when patients are addressing their pain, they're more likely to follow through, okay? So we have, for example, the individual samples. Biofreeze has come out with their professional versions. So on the roll-on and the gel, it essentially, the key ingredient now, menthol, is increased now by about 1% over other topicals that you might have used in the past. And these are just various modes of application. My personal favorite, though, is the 360 spray, because when they say 360, it literally can spray upside down, right side up, and so forth. So these bottles, literally, you push the button and you can just spray it onto a target area. Neck pain, back pain, knee pain, elbow pain, okay? And then allow that to absorb in. Patients then can take that bottle home with them, they can travel. Now, let me ask you, why is that, in my mind, so important from a pain management standpoint? Because pain is the number one reason, please hear that when you go back into your clinics, you go back into your student affils, pain is the number one reason patients come to see us. If we are just dosing them with an exercise, and I say just with an exercise, we have to ask ourselves, what is going to be their compliance to that? If they're in pain, it's going to be very, very low. Okay? One of the things that we started doing in our practice is this, is we noticed a trend of what we call one and dones, meaning patients who came for one visit, or we would classify them even as 1 or 2 visits, and where they wouldn't return. We looked at the national averages and we looked at our averages, and they were pretty consistent, about 20%. So let's think about that for a moment. 1 out of 5 patients, 1 to 2 visits into care, are self-discharging, looking for something different. I'm gonna go talk to my orthopedist, or I'm gonna talk to my primary about an injection. We don't have the science or the data to tell us why, but we do know that about 20% of the population is one or done. We had a study in our clinic where we effectively just passed out the Biofreeze. Day 1, samples, here, take those with you. We used the different topicals, we went through our normal product protocols, we went through and gave them home program and so forth. We saw a reduction of our one and dones from about 20%, about 19%, down to 4% in our ones and dones. So just by giving them a sample, which Biofreeze will give to us for free, costs you guys nothing. You can call the reps and so forth, and we saw that reduction. Why? Because there was an engagement of those patients who said, hey, my therapist is actually thinking, what can I do for the pain? okay? So I would encourage you guys to think about, if you've never almost all of you raised your hand. I've heard of Biofreeze, I've used and thought about it, but in my experience, and this is the group here, about 35–40% of you said I actually use it. Challenge, leave here today, grab some samples, go to the Performance Health booth, grab some samples, try it on something. We all have some soreness, try it on it and see what you do. But think about your patients. They are here, they are seeing us because they're in pain, okay? Another product for pain, and again, I'm gonna just toss a couple of these out at you. You guys here, put them in your hands. I want you to feel them, okay? This is silly. You're not gonna put this on a patient per se. It's just a little 2-inch, who didn't get one? I'll give one there, okay? Who else? One there, did I miss anyone? Okay. Guys, I'm out of samples right this moment, but any of you that didn't get one, head to Performance Health booth, they're free over there. Guys, how many of you use ice in the clinic? Okay, again, a large population, or you instruct your patients to use ice, okay? Here's the take-home technology advantage with the TheraPearl. Instead of our ice packs being one large surface area, we are essentially doing small little pearls of gel in multiple surface areas. Think of it this way. If you had a glass of liquid, a beverage you're gonna drink, do you want one large ice cube or many large ice cubes if you wanna get it cold? You want many because we're basically working off the science of surface energy or surface area, okay? So the take-home message is these products come in knee wraps, elbow wraps, and so forth. They're designed for pain. We can cool them, we can heat them. I don't want you to leave in here and thinking, oh, it's just another speech on ice packs. I want you to understand, no, people are actually behind the scenes thinking about what's the technology, what's our evidence for compliance, and if we can create a technology, in the case of the TheraPearl, that will give us a better cold and a better heat because we've increased the surface area, that's what we're trying to do. When you go back into your clinics, look at it and say, when you pull out those solid gel packs, the Chattanooga gel packs, and ask yourself, that's one solid surface area. No, okay? Start thinking about that. Maybe I'll try something with a lot of surface area. So again, when we're thinking about pain control, which is why our patients are there, Biofreeze, TheraPearls, okay? Now, let's look at a different product for pain control. I'm gonna ask, how many of you are familiar with kinesiology tape? Okay, again, pretty much all the hands went up there. Kinesiology tape for a lot of people is like automobiles. There's many different brands. And you start thinking, oh, I like this brand or that brand. With Performance Health, what we wanted to try to look at is to say, hey, we don't want to just create another tape to just throw into the marketplace. Can there be evidence-based practice patterns? Can we look at the science and so forth? What I want you guys to each consider, and I'm going to pass, please, everyone, I'm going to just pass some of these out, pass these around. But when you get into these samples here, guys, you're going to see samples, and it comes in rolls as well. But what we have done on the science standpoint is something very simple that no other brand out there on the market has, and it has what we call the exact stretch, so markers. So on your samples, you're going to see these hexagons, okay? Small ones and large ones. And when we look at the science on pain, this is what we want to understand, is that most of the science in the research shows us that we can mitigate pain if your tension is 25% or less, okay? How do you know when you're using brand ABC if you're doing 25% or 30% or 40%, or you think you're doing a mechanical pull, are you doing 70% or 80%? We don't really know. We can try to take a class, but it's a very subjective. So what the Performance Health tape has done, the exact stretch tape has done, is to put those hexagons there. So when you tear them, and you take a small hexagon, see that little hexagon right there? And I make all sides equal, we have been able to validate that that is 25% tension. If we take a large hexagon, and we pull that large hexagon so all of the sides are equilateral, we have been able to validate that that is 50% tension. Why is that important? Because when we are trying to have consistency, clinician to clinician within a practice, or within yourself, from visit 1 to visit 3 to visit 5, and you're documenting, I'm going to go after pain, I want to be at 25%, I can document with certainty, with validation through the research, that yes, I'm at 25%, versus just assuming, oh, I'm just doing this and I don't really know, okay? So, if we were coming in here and looking at an example of elbow pain, and I wanted to approach this strictly from a neurosensory or 25% pain reduction, I can literally apply that kinesiology tape, just like any other product that's out there, any other tape. But then when I pull that, I'm looking for those stretch indicators to be 25%, and then I lay that down, and they are throughout the tape. So again, if you are getting rolls of tape, they're going to be every couple inches, and you have that consistency. I can make those little hexagons equilateral on all sides. I now know with consistency, I can document that I've done a neurosensory technique at 25% tension, okay? Now, what if we wanted to do something mechanical? We actually wanted to adjust and try to adjust the forces and things of that nature. Well, when we take something like lateral epicondylopathy and we are looking at the biases, we have usually an extension bias, overactivation of the supinator, overactivation of the common extensors. So I can come in off of that in the same way and literally maybe dial in off of that ulna there, bias her, pull the large hexagon 50%, so equal on all sides, all the way up to its origin, apply that, and have now a mechanical load that is going, in this case, maybe bias in that ulnar position, okay, and help bias in that regard. In the same way, if I wanted to cut the tape, and all of us will use different cutting techniques to bias our tapes. If I wanted to augment the roll of the supinator, I could literally come in off that radial head, and because I'm using the exact stretch technology, again, I'm looking for that large hexagon, I'm going to pull her into 50% equal on all sides and help just facilitate that supinator. Some of us will say, oh, we'll do a skin pull. But again, if you're using a different product out there and you're just looking for the skin pull, or you're just pulling aggressively, I'm not ever going to suggest you're wrong as a clinician. I'm just saying you don't have an honest way to validate that. Whereas the research on the exact stretch says, hey, we can be pretty consistent. We're at 25% and 50%, okay? Now, I already mentioned earlier that I own my own private practice. When this tape hit the market, I was very specific with them. And I said, I'll try it, but it has to stick, because some of the tapes on the market don't stick well, and they don't stick well when patients sweat. So I challenge you, grab a sample here, go to the Performance Health booth, grab a sample and try it. I have been very excited to report that it sticks as well as any tape on the market, okay? So the advantage, what we're looking for from a functionality of a tape, does it stick? The answer is yes, and I want you guys to try it and prove it for yourself. And then what else is the advantage? And for us, it's the exact stretch indicator. Does that make sense? Okay? So the point of our conversation here is, again, let me summarize. Our patients are coming to us in pain. If all we're doing is postural corrections, mechanical joint corrections, and home program, we are going to have a struggle engaging them, getting them to stay compliant. How are we addressing their pain? What are you guys doing now for pain? If you ask therapists who have been practicing for 10 years plus, and I ask them, are you doing ultrasound? Almost all of them will shake their heads, because they don't find that clinically the ultrasound, the stem in the clinic, maybe it works as well, okay? So for those of you that are students here, we learn about the modalities. They're really exciting when we get out of school. You guys have to learn that for yourself. But a lot of practitioners have been practicing for 10 years. Maybe they're not using the ultrasound as much anymore, okay? So the take-home message is Biofreeze. Sample it. You can get tons of samples. Give them to your patient. But I want you guys to try it tonight, or try it this afternoon on something sore, okay? Biofreeze, the 360 spray, which can spray upside down, spray in reach areas of the spine. It can engage your patients. The roll-on and the gels, again, the professional versions have 1% more menthol in them, okay? And that's the key ingredient for the pain management. And then kinesiology taping. And again, what we're looking for is a consistent product that sticks well. But what the exact stretch does is, again, if you have questions, I want you to come up here, is I want you to understand making those indicators equal on all sides. Okay, Andre Labe is going to have a talk before your next session in about 45 minutes on how to actually, we might use this to tape the knees, tape the ankles. You guys can come back for that, but I want you guys to feel that. Thank you guys.